Why did I join Lightning Step? Um, Spent 30 years in healthcare IT, been in just about every specialty that makes up both physical medicine as well as behavioral health. And it's no secret that in today's society we have a mental health and an addiction crisis. There's a lot of resources and a lot of money being thrown into this particular space, and therefore there's a lot of growth opportunity. Lightning Step is just so well positioned to take advantage of that growth with their integrated all in one solutions. And that's exactly what kind of drew me here. I love the opportunity to be able to build things from scratch and take bootstrapped organizations that have really been successful to start out with and now need some professional leadership and just some general blocking and tackling to be able to help an organization really grow to that next level. And that's why we decided to come here at Lightning Step, and I've been so happy that I did. Yeah. So why this CEO role versus others in different EMR companies? So in some of my past positions, when you're in the private equity world and you're looking at these type of organizations, in a lot of cases investments have been made or companies are selling because they're in some kind of trouble, and trouble's probably not the right word, but more along the lines of there's technical debt. It's an older product, and they're kind of hitting that crest of growth. Lightning Step's the opposite of that. They're just really getting started. The foundation, the building blocks of Lightning Step are already there. And so now we've got that growth. And to me, that's probably the biggest difference for me is instead of coming in and doing cleanup type of work to help grow, we're now putting additional building blocks in place. We're building out leadership. We're building out talent. We're building a company for scale in a situation where we genuinely have an opportunity to be the number one leader in this space through thought leadership, through innovation, and things like that. Lightning Step is just so uniquely set for that already today, and it's really exciting. A lot of times people will ask me, how does a technology solution really help in healthcare? How do we allow clinicians to spend more time with patients? And in the addiction treatment space, people are really in life and death situations. So our solutions, our technology allow clinicians to focus really on what matters, which is those patients, because they have all of the data elements that they need right there. Less clicks, something that's really intuitive to use. So I have immediate access to information at the time, at the point of care when I really, really need it. I have access to analytics and business intelligence, so I can have the system help me predict who is the most at risk and when am I running a risk for a potential relapse, or when do I need to reach out to them? When do I need to provide additional care and service? And that's a lot of what technology can do for our clinicians. Further, they're running a business. No money, no mission. So without a tool that allows them to get paid, to get proper reimbursement for the care that they deliver and do so in an efficient manner, it gives them the opportunity to be profitable, to then give back to what they're trying to do for society as well and for their patients. And again, I think we're uniquely qualified there because it's a single solution. It's not a bunch of band-aided interfaced different systems combined together to one. We are all in one together. So we see a lot of inefficiencies in treatment facilities. And a lot of it stems from just having all of these disparate systems that make up the infrastructure of what helps you run your business. So appointment scheduling solutions or marketing solutions, inbounding solutions that have different contracts, different sign-ons, different workflows all together interfaced, band-aided into a clinical system to where all of your note taking and your intake treatment forms and all of the clinical solutions that our clinicians work through. Completely different set of solutions, don't always have access to data. Then feeding a completely separate contract financial solution on the back end that creates situations where revenue may just simply get lost. I'm misbilling something and I'm not alerted to that fact because it's not truly tied together to the clinical system. That's where Lightning Step really shines. It's one system, it's one contract, it's one vendor, it's one database. Everything all lives together in one, presents that data at the time that the clinician needs it, number one, and then number two flows all the way back to the financial systems to not only ensure that I'm getting paid for everything that's been performed, but that I'm getting paid accurately and quickly. And that makes a big difference for profitability and viability of treatment centers, which is so critical given the fact that we just don't have enough access to care today. So fragmentation in systems, and again, it goes back to this all-in-one solution that Lightning Step is at its core. And I think we really got that right when we first set out. One of the our first customers, that was the solution that we were trying to create, was an all-in-one solution. Because if I'm working in so many different systems with duplicate entry, with completely separate reporting functionalities, I don't have access to the same information. If I have to go digging for different reports from marketing, from intake, from my clinical solutions, and any type of outcomes data that I then need to share with my payers, and in all my financial reporting requirements, either to my investors or to the payer solutions or otherwise, none of that data is structured in the same way. So it creates a lot of additional work and inefficiencies where we've seen people reduce staff, increase revenue, and see the same amount of patients. And obviously, in a case like that, you're going to expect better outcomes because I can spend more clinical time with patients and still keep my business viable. So, one of the coolest things about Lightning Step, uh, in a sense anyway, is that a lot of us have been down an addiction journey in some form or fashion, whether it's that individual or it's their family. And that's true for just about all Americans. But it creates a unique type of dedication and desire to give back. If you've been in a life threatening situation and somebody helped you, especially in the addiction treatment community, there's it's almost taught to you that you should give back. You should help other people. And we've got a lot of those people on staff today. And I've never had a team of people that are so completely dedicated to helping others, especially in the addiction world, than a lot of our team members. And it's because they've been down that journey. They know how dark it is and what that pain is like and how critical it really is. And so we wake up thinking about these people and we go to bed thinking about these people and how can our technology and our involvement in our this industry help those people in our communities. That can't be taught. That is as unique as anything in this in healthcare for that matter, and one of the things that I think makes Lightning Step very, very unique in the market, incredibly unique to all of our competitors. So people ask a lot, where do we see the industry going? Where is behavioral health going to be 5 years from now? And I don't have a crystal ball or anything like that, but we're starting to see tremendous strides in innovative type of solutions, mainly driven around AI. So the promise of electronic medical records was to really transform the quality of care through access to information, to really be able to report on and track outcomes and really get to data very rapidly. And what's happened is regulation, especially governmental regulation, has really made EMRs more and more difficult to use. Lots of clicks in order to be compliant in several different ways. I think the introduction of AI and more continuous speech and ChatGPT type of functionality is going to bring it back to a more conversational level. So I'm not on a keyboard, I'm not clicking a mouse, I'm talking, I'm interacting with patients. I've always had this vision of I walk into a treatment room, an exam lane, a patient room, regardless of whether it's physical medicine or behavioral and or mental health. And the system knows that I'm here. They know the patient. They know the patient's history because the computer is just so fast in presenting that information contextually. And I can just talk. I can engage with the patient. The system knows how I chart. It knows this particular type of disease state that the patient may be in, and it works through that just instinctively, it is going to change the way that people interact with the technology in their offices and make it much easier and much more comfortable for the patient, which is probably the most important thing. I've been asked quite a bit lately is what are some of our top initiatives for the next couple of years here at Lightning Step? And, we're really working on building a company for scale. Our goal is to be the top provider of behavioral health technology in the United States in the next several years. We are looking to grow rapidly, and we're going to do that through innovation, thought leadership, and really bringing good, solid people and technology and innovative strategies to our customers. So we want them to be able to provide better care. We want to give them better access to the information to provide better care. And then we want to make sure that they get paid accurately and as quickly as possible so that their businesses are as profitable as possible so they can continue to give that outreach to patients in the communities that they work in. So we're going to spend a lot of time and effort on our product, on innovating our product, on building partnerships that really expand the breadth and scope of the Lightning Step solution and do it in such a way that it becomes very easy to use, very intuitive, and it just kind of becomes that platform that everybody already knows and loves, and it just kind of works. It learns how people interact with their patients and work within their offices, and everybody's a little bit unique, and it just works.